Many years there's been this misconception. High cholesterol is one of the most important risk factors for heart disease. I want to break down the data and share what I've published on this to look at it properly. Joe, the association between cholesterol and heart disease came from the Framingham study, started in Massachusetts in 1948, which followed 5,000 people over decades. Many risk factors like type 2 diabetes, high blood pressure, smoking, and high cholesterol were identified from that. But what's interesting about Framingham is that the significant association between total cholesterol and heart disease was only present when total cholesterol was over 300 milligrams per deciliter, which is rare in the general population. Most of your cholesterol is genetic, 80% in fact. Cholesterol is a vital molecule in your body. It's not just about heart disease. It's crucial for maintaining cell membranes, supporting your immune system, hormone production, and vitamin D synthesis. So, it's largely genetic and can be influenced by diet, triglycerides, and HDL, the so-called good cholesterol. The key point is, total cholesterol is not a good indicator unless it's extremely high. If it is very high, there's an association. But most of those cases involve a genetic condition called familial hyperlipidemia, which affects 1 in 250 people. On the other end, people with very low cholesterol, less than 150 milligrams per deciliter, have almost no heart disease. People with genetically low cholesterol tend not to develop premature heart disease. Another crucial point is that most data on heart disease and cholesterol is only up to age 50 or 60. What's rarely discussed is that after 50, as cholesterol drops in Framingham, mortality rates actually increase. That's a red flag about the focus on cholesterol, especially in older populations. Now, the most compelling evidence that the association between cholesterol and heart disease is weak was from a 2019 paper I co-authored with 2 other cardiologists. We looked at all the drug trials on lowering cholesterol. The most robust data, based on randomized controlled trials, shows there's no clear correlation between lowering LDL cholesterol and preventing heart attacks or strokes. The whole premise that lowering cholesterol protects you is, frankly, BS. It's a weak link at best. So, how do statins actually work? They do have a small benefit, but the real advantage isn't just lowering LDL. It's in their anti-inflammatory and anti-clotting effects. That's what really helps prevent heart attacks and strokes. When you break down the numbers, the benefit for low-risk individuals is about 1%, or roughly a 1 in 83 chance of saving their life over 5 years if they take a statin faithfully without side effects. That's around 4 days added to your life expectancy. Hardly a game changer. In patients who've already had a heart attack, the benefit is still minimal. Even then, the chance of the medication actually saving a life over 5 years is about 1 in 83, and the chance of preventing a second attack is about 1 in 39. Most of these people only gain a few days to weeks in life expectancy. Looking at population data across Europe, an analysis over 12 years showed no real reduction in heart disease death rates due to statins. This suggests millions prescribed these drugs may not be making the impact we're told they do. Even people who've had heart attacks often stop taking statins within a few years because of side effects, so their real-world impact on population health is limited. Despite being one of the most profitable drugs in history, statins' benefits are marginal. Once this information has been published and people are aware, what's the reaction? There's been a lot of backlash, smear campaigns, and even efforts to discredit the work. I've faced significant challenges, lost jobs, defamation, all for speaking the truth. The leadership at institutions like Oxford University, where a department received over £200 million from the industry, kept data confidential. They promoted guidelines based on this data, which was not independently verifiable. I pointed out that they claimed only 1 in 10,000 people experience problematic side effects, but that doesn't match real-world reports. This conflict of interest clouds judgment. They're not always looking at the full picture. I believe in transparent, evidence-based medicine. Instead of pills for everything, we should focus on lifestyle changes, low-carb diets, exercise, and natural health strategies that can be more powerful and sustainable. That's why I continue to speak out for ethical medicine, even when it's uncomfortable. Remember, as public health advocates say, You've got to grow a rhinoceros hide when your work threatens industries or ideological groups. I've learned that protecting truth and transparency is worth the personal cost.